Hi, everyone. So today we're actually talking about sleep medications, and I'm so happy to introduce you with Stacey D'Angelo. She is a pharmacist and founder of Your Simple Health, where she helps people to optimize, streamline, and reduce medication use. So she specializes in pharmacogenetics and deprescribing, which she'll discuss with us a little bit more later too. But you can find her at simplehealthpharmacist.com or on her social channels at Your Simple Health. And I'll be linking those up as well in the description for this video. So first of all, Stacey, thanks so much for agreeing to come on and answer some questions. What had happened was we had met through Instagram, first of all, which is
Mhm.
awesome. And the other thing that happened was I just loved your post around deprescribing and your conversations that you were having that were just so different from probably what I'd seen before. But I
Mhm.
also love the fact that this is exactly what I was also working with my patients
Mhm.
on, and that you have this other level of expertise here. Um, just as a back end too, when I had sort of reached out to you, I said,
Mhm.
you know what, I know this community that has a lot of questions. Can I go to them, ask them a few of the key questions that they want to talk about, and I'll come back to you. And could you talk about that?
Mhm.
And one of the things that they really wanted to know about, and what we're talking about today, are sleep medications.
Yes.
So we're going to deep dive a little bit into this because I think you have so much knowledge that you can share with us. And what we do know is that cancer survivors, about maybe 40% or even more, can have sleep issues after treatments that can last
Mhm.
many years. And it's such a big thing in my practice too. So I'll let you sort of go ahead and talk a
Yeah,
little bit about what you know, and I'll also ask you a few questions. So,
of course. Well, thank you so much for having me. It's so lovely to meet you through the wonderful world of social media, how it brings people together and like-minded individuals. And I think the collaboration with naturopaths and with deprescribing and pharmacists like myself is just so natural because
mhm,
as you're working with people towards better health, if they've been on medications that are no longer right for them because they've perhaps worked on in that area of their life, what happens next, right? And how can we
yeah.
reevaluate and peel back those medications whenever necessary, but do it in a way that's safe and supportive for the individual? So I think it's a
Mhm.
great synergy, and I'm just so grateful to be here with you. And I love the way you practice and the way you teach your channel. So it's a pleasure to be here.
Yeah.
Especially around sleep, because this is an area that I'm really passionate about too. And I think,
Mhm.
whenever I talk about deprescribing, so first of all, a lot of people haven't heard about deprescribing. Like, what is that? It was actually first coined in the literature only 20 years ago in 2003. So it's relatively new in the medical field, and that's within medicine and literature. So a lot of people haven't heard about this term. And a lot of times when I talk about it or describe it to people, I actually use this example of a sleeping pill because I think it's something that a lot of
Mhm.
people can resonate with. A lot of times you'll have a life stressor, an event, maybe you're really busy at work or going through grief or loss, and you're just really struggling with those ruminating thoughts that are keeping you up at night. And a lot of people will turn to a sleeping pill, whether that's something over the counter or a prescription medication. And it's really easy for your body to become dependent and to become quote unquote hooked on these medications, where when you want to stop taking them or you feel like you don't need that a sleep aid anymore, your body just really struggles without it. And you can come across a lot of symptoms in terms of, that insomnia, anxiety, agitation, a lot of what brought you to the medication in the first place, and sometimes even more, even exacerbated to what it was before because your body's so used to having that medication around.
So I think that's an interesting point that you make too. It's the stuff that actually brought you to the medication. Those are some of the
Mhm.
side effects that you could also potentially be feeling, especially when you're trying to like discontinue that use, right?
Mhm.
Or trying to just even decrease the amount. So I love that you brought up that point because I think a lot of people may not realize that some of the side
Mhm.
effects are exactly the same as what you were suffering with before you even started taking the medication, right? So
Exactly. So
so
teasing
interesting.
out sometimes what's a symptom of withdrawal or dependence on the medication
Mhm.
versus what brought you to the medication in the first place, or what
Mhm.
we call rebound symptoms, can sometimes be difficult. And it can lead some people to think they still need the medication when they may not. So just, I think,
Mhm.
awareness that dependence is real and that withdrawal symptoms can come up, even with sometimes what you think might be benign over the counter products for
Right.
sleep and for other things. Just as important to know because maybe it's not that you still need the medication. Maybe you just need to deprescribe safely and slowly taper off that medication.
Right. So, in your experiences, because I think this is one question that I can see patients and maybe people out there asking, is there a dose? Is it dependent in your experience on the amounts? Because sometimes people will say, I'm on a really, really small dose, right? And
Yeah.
so, is this
Mhm.
something that you also encounter in terms of does dose actually matter? What some of the side effects that
Mhm.
you might be seeing with your patients too?
That's a
Um,
great question.
yeah, and what's a safe dose or how long should people actually be on these types of medications
Yeah.
in general?
Yeah. That's a really great question. And sometimes I hear like, oh, I'm just on a baby dose.
Yes.
Or um, no, there's no minimum or maximum amount.
Mhm.
There are factors that increase your risk of dependence, such as dose, if you're on a higher dose, how long you've been on it, your age, other medications. But also, some people are just more susceptible and we don't know why. So, even on a very low dose of medication or for a short period of time, I've seen people become quite dependent where it takes them quite long to come off. So, it's a very individual process and it's really important to to understand the patient and go with what they're actually experiencing and
Mhm.
not kind of there's not a one size fits all to this respect.
Right, because I think part of our conversation when we were emailing back and forth to each other was sort of like figuring out what the underlying causes also
Mhm,
were. So one of the things that you had talked about, and I'm making a separate video because I really wanted to discuss what you do, is
mhm,
just natural perspectives to consider around sleep
mhm,
issues, right? Or
mhm,
insomnia. But in terms of our alignment on some of the natural stuff that we may
mhm,
consider, things like magnesium and theanine and passion flower, for example, melatonin or GABA. But your point about the fact that if you're on prescription sleeping aids, something like GABA could also be depleted or other
mhm.
things could be depleted, actually making things worse in the long run, right?
Yeah,
And creating more of that dependency, maybe even.
yeah.
Can you speak to that a little bit more?
Yeah, totally. There are definitely so sleeping aids is one of the classes of medications that can deplete certain nutrients in your body. And there are other classes we can have this talk
Mhm.
about another day. But definitely when it comes to medications, all of the sleep aids can deplete your body, specifically in melatonin and GABA. And so that could theoretically be part of the reason that you're experiencing some of these withdrawal side effects when you come off it. So having um, being replete of those, hormones and minerals that your body may be deficient of because of taking the medication can improve your chances of success or mitigate those symptoms that you have when you're coming off the medication as well.
So important. And I just
Mhm,
posted not too long ago about just the importance of melatonin with an anti cancer perspective.
mhm,
And so that depletion is something definitely that we would want to consider
yeah,
and want to work on, right? If
mhm,
it is an issue. So I'm so glad that you talked about that actually. So, in terms of sleep aids, because this is a question I know a lot of people might have, is there one that's safer or
mhm.
not as addictive, I guess, or something that you would be more dependent on than other ones? What would be a safer option?
Yeah, so when we're thinking about prescription medications options for sleep, there's kind of three categories that we think about. One is benzodiazepine. So these are drugs like Ativan or Xanax. They're also used for anxiety, but they can be used for sleep. These are probably the most risky medications, and I will say they're the most difficult to stop, whether you're using them for sleep or anxiety in the long run. And they come with all of these come with their own set of risks, but they come with quite a bit of risk, especially as you get older. That's one class. The second one is what we call Z drugs. So these are drugs like Zopiclone or Imovane, Sublinox, Lunesta is another one. So they're sleep prescription sleep aids, but they're not benzodiazepines. They're thought of to be a little less um, dependent causing than the other medications. But I will say, like from a pharmacogenomics pharmacologic perspective, they're very similar and they do still cause dependence. So I think
Right.
they're kind of touted as being safer, but I
Mm,
still would express a lot of caution when using them.
got it.
They're not a controlled medication. So they're kind of like, just thought of as a little bit safer, but they do still come with a lot of the same risks of dependence, number one, and also as of kind of cognitive impairment, of,
Mm,
brain fog and risk of falls and those types of things.
mhm,
And the last class that we see sometimes used off label is antidepressants. And certain antidepressants we'll see more often than others. So, for example, if you've heard of trazodone, especially we see this used in older people, mirtazapine or Remeron, and then a group of antidepressants called tricyclic antidepressants. Um, we don't see those used as much. They do have some side effects, but they also work for neuropathic pain and migraines. So, in a patient who, for example, is experiencing a lot of migraines and having trouble sleeping, sometimes they'll kind of kill two birds with one stone by using a medication like that.
right.
Those have less risks, but they come with their own separate set of risks and they still can cause dependence.
Mm,
So, you
mhm.
still may need to taper off of them when you're ready to stop.
Right. So tell us a little bit about, because I love that you sort of broke it down for us in terms of class and sort of riskiest, maybe in terms of
Mhm.
dependency, and then less so, but still having that potential for needing to deprescribe and decrease those dosages slowly. So you're not feeling horrible and not being able
Mhm.
to sleep at all, right? And then working on those underlying reasons too, as to why people are not sleeping, being so critical and important. I know we had sort of mentioned in our emails too things like sleep hygiene and lifestyle. And I will
Mhm.
definitely go into that more deeper in another video. But those things are actually really critical. What is the reasoning behind the sleep issues? Is it because cortisol is too high and there's a lot of stress
Mhm.
happening? Are we not winding down properly before we're going to bed? Is the environment around us not exactly what it should be? Are there maybe potentially things like sugar regulation issues and other things like that? Is sort of what goes in our usual visits as well, and I
Yeah.
think probably yours too. Tell us a little bit about deprescribing. Like, what is it, first of all? Because as you said, it's such a new word. And
Mhm.
when you said it, and when I see your post, I'm like, I get what you're saying and I love it. But I think a lot of people might not understand what that means.
Yeah.
And also, how can we safely sort of taper off of sleep medication? So that's one of the things that I've also worked on in the past with some patients. Obviously, on their end, they would be working with their doctor, or
Mhm.
maybe even someone like yourself, to figure out how to taper the medications as we do more natural things. But tell us a little bit more about that.
Yeah, exactly, and that's your best chance of success right there, that collaboration, and, um, so deprescribing is basically, the planned, um, reanalysis and peeling back of medications that are no longer serving an individual. So it's all about reevaluating. Obviously, medications are started with good intention for a benefit. Um, but they don't always continue that benefit, or the benefit doesn't always outweigh the risk over time. As you can think, your health status changes, your symptoms change, what brought you to need that medication in the first place changes, as well as things like aging and different health conditions that may come up may change that risk benefit profile for that medication. So deprescribing is looking at the whole um, medication regimen with that eye to reevaluate every single drug to see if the benefit still outweighs the risk. And whenever possible, we want to peel back medications, whether it's reducing a dose, stopping a drug. Sometimes we can stop a medication, just stop it cold
Mhm.
turkey. Um, Other times, medications require a little more care in terms of peeling them back, and we need to taper it down slowly to optimize the chance of success of getting it off without coming up against some of these side effects.
Mhm.
So, deprescribing, I often see it kind of in two buckets. One is in the realm of people on multiple medications. Typically, we're talking about an older population where they might have started different medications at different times, and it's about that reevaluating about a whole list of medications and what can we peel back here. Also, if you've established you want to stop or reduce a medication that's more difficult to stop, like sleeping pills, deprescribing can involve that careful tapering down of that medication to get you off it successfully. Because I will say, even when you're reducing the dose as prescribed and in conjunction with the doctor, it's still possible to come up against these withdrawal symptoms. And
Mhm.
sometimes doing it a little more with more support and a little more carefully, tapering more slowly, can optimize your chances of success.
No, that's amazing. No, that's exactly what I encountered actually with a few of my patients, but even in my personal life with my parents. So my
Mhm,
mom had a brain tumor when I was 10 and has had to be on medication since that time.
mm,
But what hadn't happened was a reevaluation, like what you
mm,
were talking about, Stacey, because as she was aging, she no longer needed to have her period, but she was essentially medicated in order for
mhm,
her body to produce that. And yet here she is in menopausal ages, still
mhm,
having one. It was only when I asked her about like what's been happening with your meds and all that kind of stuff that
mhm.
we started to realize you need a reevaluation of your medications. How often should people get these reevaluations, do you feel? Is there a time frame where you would start looking at, okay, well, you've been, for example, let's just talk about sleep aids because I'm sure all the medications are a bit different. Is there a set time where you're like, we should reevaluate if you need this now and how much you actually need of it? Like, how long can people stay on the sleep meds before we reevaluate?
I mean, the least amount of time possible. And you need to think about what brought you there in the first place. Why did you start it? Is that issue still there for you? And I would say that the least time you can be on it, the better your experience coming off of it will be. So I think just always
100%.
having it in the back of your mind to see, is this, again, just coming back to that situation, is it a work issue that you're kind of keeping you up at night? A month later, is that work issue still bothering you? Can you think about peeling that back? Can you take it less frequently or maybe reduce the dose?
Mhm.
Um, so I there wouldn't say I've seen people on. I'll tell you a story. So
Mhm.
one of my first patients in the realm of deprescribing that I worked with a significant amount of time was with one of these Z drugs. It was with Zopiclone.
Mhm.
She was started on Zopiclone around the time of menopause. Obviously, she was experiencing insomnia as one of her symptoms throughout the menopausal transition. And so she was started on this sleep aid. She came to me over 30 years later, still using the medication. And she had tried in the past to stop it. She had tried in conjunction with her doctor. And she was really kind of like at her wits' end. She wanted to get off the medication, but she
Mhm.
couldn't. And so we were able to actually work with her naturopath to support her lifestyle in terms of sleep hygiene and natural health products to support her in that way. And then we were able to slowly taper down that medication way slower than she had done before, way slower than her doctor even knew was possible
Right.
to get her off within 6 months. So it
Mhm.
takes time sometimes. And again, depending on how long you've been on it,
That's amazing. 6
help
months
to
is
guide.
great.
Yeah, it will help
Yeah,
to guide how quick or how slow you need to do that.
right. No, that's such a good story because you're right. People are often not necessarily reevaluated, and it could be years
Mhm.
like that where you're because the questions we might get when we go into the doctor's office might just be, how's your sleep? Right. But
Mm,
not, and if it's okay, we may not have that conversation. So I think you bring up a few good points in that we sort of have to be advocates for ourselves too,
mhm,
in this realm in terms of when we're put on a medication, asking for a sort of analysis of when that medication
yeah.
can be reduced, or maybe we can change it up. But someone like yourself being able to help with that deprescribing process. So when you were able to, like for this particular story, were you able to make like a different dosage for the client? Like, how do you normally work in this scenario?
Yeah, so depending on the drug, um, oftentimes if they're really struggling with coming off or they need a slow titration schedule, we'll get the medication compounded. So that's getting it individually made for you in a specialty pharmacy in the lab. So this was compounded into a liquid. So we were able to reduce the dose a lot slower than what's commercially available. So the commercially available pill comes in, it does come in a tablet that you can break in half, but that's pretty
Mhm.
much the extent of it. You can kind of chop it up with a pill splitter, but it's really difficult to do
It's
that,
not accurate.
especially
Yeah.
on some of these difficult things. So we were able to compound a liquid and use an oral syringe to really carefully taper that dose slowly over time. And she was able to do that without coming up with these really difficult withdrawal symptoms that she had in the past.
Right. And I think what you had said in terms of like there may still be some withdrawal symptoms, and
Mhm.
just that understanding that even though we're doing it in the safe manner and it's
Yeah.
a slow process, you could still come up with some of those symptoms.
Yeah.
It's just going to be less because you're doing it in a stepwise manner, a little bit slower than they might have done in the past. But I do love the idea that you can compound what you
Mhm.
need, and it's way more like I've tried those pill cutters and so
Yeah.
really hard sometimes to get it
Mhm.
exact. And then to have to like do that in quarters or whatever it might be, it's
Mhm.
a much better way to be able to do that for sure. Um, what I love about what you also do is that you work with either the doctor or a naturopathic doctor to
Mhm.
sort of help with all of those things. What I found in my experience too is those natural health products that we were talking about before can definitely help with some of
Mhm.
the side effects potentially, or just coming off of it and putting you back into an appropriate sleep pattern,
Yeah.
and getting to the like root cause of things, right? So
Yeah.
that's another thing too. What are some last things that you feel like, hey, cancer thriver, you need to know this? Like, is there anything lastly that you would want cancer thrivers to know or survivors to know who are maybe going through either needing this medication, being on this medication, or thinking about getting on this type of medication? I know there's probably so many things that you could share with us, but is there one important thing that you're like, I need to send this message out to everyone?
Yeah, I really just want to share that it's important that you feel empowered about your health. And um, you are a really important piece to the puzzle. No one knows your body better than you. And I think it's important just to be able to advocate for yourself, to be able to make an informed decision. And if you do find that you're not able to, you don't have the information or you don't know quite the next step, seeking out the right guidance from a health professional to help support you in that. But at the end of the day, your health doesn't happen to you, it happens with you, and you need to be an equal part in that kind of decision making process. So I would just encourage people, not just around lifestyle, but around your medications to take charge of that, to feel empowered and to know that support is there for you.
Mm,
And I would also think, just speaking back to your story, Becky, with your mom, I
yeah,
would also encourage you to look around at your loved ones too, because I think this is
so
especially important with the aging population. 2/3 of Canadians over the age of 65 are on 5 or more medications,
it's so
and
crazy.
25% are on 10 or more. And so the more medications it shows, the more risk of falls, of hospitalizations, and just mortality in general. So I think if we can just have an eye out for our aging parents out there, I think that can really be helpful too. So,
That's so good. Thank you so much. This was so enlightening. I know all this information people are going to absolutely love too. And your knowledge base and everything else for me is just so key and important because a lot of these conversations aren't being had, first of all. I love the sense of the person and how empowered we should feel and how in
mhm.
control we can be. Our voices should be heard, especially when we're tapering off, when we're feeling all these
Yeah.
things. Only you know how you're feeling and what you
Mhm.
need to be doing next. And so, that piece of it being so important totally aligns with how I feel too. And you see a lot of my posts. So empowerment is a huge one for me too. And
Mhm.
looking at your loved ones, you're right, because had I not asked, she would
Mhm.
have continued on this medication that actually wasn't serving her. If anything, you're right. It was also putting her at risk for
Yeah.
potentially more negative impacts overall, right?
Mhm.
So I love all of that. So for everyone, I'm actually going to be posting your information on many different areas so that they can find you easily. I know you're on social media as well, and we're going to ensure that people can contact you if they need your help as well. And certainly, if there's collaboration opportunities, we already talked about, being able to work together in that realm as
Mhm.
well, which is awesome. And I also just really want to encourage everyone to follow you. You have great information on your page as well. I know Instagram, you've been posting a ton of stuff that I've actually been gulping up in terms of just the information. It's just a different realm. Like you're seeing
Mhm.
life or the data in terms of the eyes of a pharmacist, which is
Yeah.
also so needed. And so I think a lot of our viewers will probably love that as well. And the other thing that I would also love to share here is that we love everyone's support. So if you want to comment on anything here that we've
Mhm.
discussed, I'm sure myself or Stacey would be able to comment on those things or respond to that. If you wanted to like and share and save, or even subscribe to any of the channels that this might be posted on, we love all of that support too. And we will definitely come back with more. I
Yes.
would love to have you back. So have
Thank
a
you
good
so much for
day.
having me. It's such
Oh,
a
of course.
pleasure. And yeah, I would love to answer any questions that come through. So feel free to comment or DM me or anything like that. I'd be happy to chat.
Amazing. Amazing. Have a great day, Stacey, and we will talk
Thank
soon.
you.
See you
You too,
guys.
Becky.